Okay, let's go ahead and get started. We're at 3 after, and I will just do my best to enter people as they come up, but it's been slowing down. And I've just started recording this as well, so hopefully if anyone is missing, wanted to be here and isn't able to, they'll be able to access the recording later. So hello again, my name is Christina Clark-O'Karmas. I'm the Executive Director at the Alabama Campaign for Adolescent Sexual Health, and you are on the Sex Ed in Alabama webinar. So if you think that you're not in the right place, maybe you can take care of that now, but hopefully you're all in the right place. I'm excited to see you all here. It looks like we have about 16 people who have joined us today. We had about 30 or so register, so hopefully some more will trickle in. But considering that this is our first webinar, I think this is a great turnout and I'm really excited. So as I said, welcome, hi, hello. I would love if you all would take a moment to just write your name and organization, and if you're from, out of state, well, just write your city and state, because I'm not sure I know all the names that were on the list. So if you'll do that in your chat box, if you go to the bottom of your screen and hover, you should have the option to click chat, and a chat box will come up and you can write in there. So we have April Martin from Auburn, War Eagle. Jessica Chambliss from UAB School of Public Health. Danita Harris from Tuscaloosa. Hi, Danita. Valerie Lockett was introduced herself earlier. She's from ADPH. Clarissa Farrer, I hope I'm saying that last name right, from Mobile County Health Department. Carol Cannon from Mobile County Health Department. Enrique Daniel from Human Rights Watch. Hi. Elizabeth from Auburn. Isabel from Tuscaloosa. I'm going to lose my people. Delane, if you can't hear me, you might want to check the volume on your computer. There may also be an option at the bottom of the Zoom where there might be the volume turned off, but I believe others can hear me, so I'm sorry to say it may be an issue on your end. We also have Jada from Mobile Women's Resource Center, Andy Lawhead from URGE. Hi, Andy. Roll Tide. I won't leave y'all out. Carol and Clarissa used to work at Mobile County Health Department when they had the TPP grants. So great to have y'all here. Vakaya, I hope I'm saying that right. Vakay, Mobile County Health Department. So lots of Mobile representation here today. I hope y'all are staying healthy. I know Mobile's kind of a hot spot. Anyone else that wants to introduce themselves real quick? I'm so excited to have some great representation from across the state. Yes, feel free to say hi to one another, and hopefully this is a little introduction on how you can use the chat box. So we'll use it a little bit here later on. So as I mentioned, I am recording today's webinar. It will hopefully be accessible on our website after today. So you can share it with colleagues who maybe weren't able to attend, or you can go back and reference it later yourself. So you're all currently muted and you shouldn't be able to unmute yourself. If you have questions, I would love, throughout the presentation, I would love for you to just make a note of your question, and I'll have times throughout the presentation where I ask for questions. That'll just really help me to be able to present and not have to be also paying attention to the chat box, which is on my second screen, and it'll just hopefully make this all go a little bit smoother. This is my first time doing a webinar, and it's just me managing it. I've been on some national webinars where they have folks who are, co-managing it, and I'm really happy for them, but it's just me. So if you can hold your questions till I ask for questions, that'd be great. So I think that's all the housekeeping. Oh, I do want to point out, so if you go to the bottom of your Zoom, and like I said, you hover, you get a little toolbar that comes up. You should see the chat feature. You'll also see a poll feature. So that's not active right now, but it will be about halfway through the presentation. So I just want you all to know where that is. Okay, so I just want to give us a brief overview of our time together today. So here's where we're going. So if you've been following us on social media or however you found out about this webinar, you're probably asking yourself, or you may be asking yourself, what is Sex Ed for All Month? Why Sex Ed for All? So we're going to address that first and foremost. We're going to review the sex education law, the HIV/AIDS mandate, and the 2019 Alabama Health Course of Study. So we're all up to date on what policy is influencing sex ed in Alabama. Then we're going to do some interactive overview of Alabama sexual health outcomes and behaviors. So that's just going to be a time where we review some data and just so you can see sort of how the policies affect actual outcomes and behaviors. And then we're going to also talk about efforts to improve sex ed in Alabama. And we're going to do some brainstorming around what we can each do. And then we're going to do some skills building. So anyone who either works in sex ed or works with young people where sex ed might come up or sexual health topics might come up, I want to leave you with some practical tips for how you can incorporate sex ed for all into your work. So with that, let us get started. So the first thing we're going to cover, why sex ed for all? So starting last year, national organizations began to move away from teen pregnancy prevention language. So it used to be that May was Teen Pregnancy Prevention Month, and now we're moving toward Sex Ed for All Month. The Alabama campaign also made this move last year in May. We used to be the Alabama campaign to prevent teen pregnancy. And now we are the Alabama campaign for adolescent sexual health. So why did we make that change? Great question. So we and national organizations have made this change. One, because this language around teen pregnancy prevention can be harmful and shaming to teen parents. Just because someone becomes a parent at a young age does not mean that their life is over or that they'll never finish high school or go to college. There's a lot of harmful stereotypes of teen parents, especially teen fathers. So that's one big reason to move away from teen pregnancy prevention language. We also felt that it wasn't trauma informed. So for the reasons that I've already mentioned, but also because some young people don't have the ability to decide whether to engage in sex, let alone whether they'll carry the pregnancy. Sexual assault, sexual coercion, birth control manipulation, lack of access to reproductive health care all play into the various factors as to why a young person might become a teen parent. So we wanted to, again, have a more trauma-informed approach. Oh, sorry. There will always be some young people who, despite having all the information on how to prevent pregnancy, will want to become a parent. As adults, we may not agree with that decision, but it's not our decision to make. The Alabama campaign, we promote informed consent and decision-making and bodily autonomy. So this means that we have to accept a young person's choice to become a teen parent if that's what they choose. And then finally, sex education is just so much more than pregnancy and disease prevention. So if you would, in the chat box, tell me, what does sex ed for all look like for you? What would that include besides pregnancy and disease prevention? Isabel says LGBTQIA plus affirming. Yes, absolutely. For anyone who may not know, LGBTQIA is lesbian, gay, transgender, queer, intersex, and asexual plus, meaning more, affirming. Jessica, education that informs healthy relationships. Kelsey, parenting classes. Andy, talking about body image and healthy relationships. Carol, responsible behavior. Delane, forming boundaries, respect for yourself and others. Valerie, empowering young people with tools to make the best decisions for themselves regarding their romantic relationships. April, relationship standards and values. I love this. It's about so much more than just preventing a pregnancy or preventing a disease. Others? Well, I think this is a great starting list. Danita, how to respond to others when in pressure situations, communication, communicating their desire to others. Yep. So important. So in short, in summary, we believe in sex ed for all because we believe that it's a human right. So we believe that all people should have access to sexual health education. So now we're going to move to some of the policies that inform sex ed in Alabama. So we're going to talk about the sex education law first. At the Alabama campaign, we often say that this is a permissive law, but that certainly doesn't mean that we think it reflects what we would like to see in a sex education law. So to start, the sex education law is not a mandate. It is what we call an if-then law. So it means if you teach sex education, then you must follow these guidelines. I'm going to do something real quick. Okay. So let's talk about what those guidelines are. We'll go through the good, the bad, and the ugly. So the good, we say that sex education or the sex education law in Alabama is permissive because it defines the minimum content to be included in a sex education program. So if the minimum is that I must emphasize abstinence, which that is what the minimum in the law says, then that's the floor and the sky is the limit. So if at minimum I have to talk about abstinence, I can also talk about safer sex practices. Course materials should be age appropriate. So we absolutely agree with that. What is age appropriate for someone in elementary school is not age appropriate for someone in high school and vice versa. We tend to point to this because oftentimes people want to do an abstinence only approach with high school students, and that's not age appropriate for high schoolers. They need a different message that certainly would include abstinence but as an option, but also includes other options for how to protect themselves. So if you teach sex education, you have to talk about contraceptives and emphasize the increase in protection by using contraceptives. So if you only teach about abstinence and do not discuss contraception, including condoms, that's actually breaking the Alabama state law. So a lot of times we hear that this is the abstinence law, or people think of it as an abstinence law, and that's actually just not true. This law says if you talk about sex education, you do have to emphasize abstinence, but you also have to talk about the various forms of contraception and emphasize the increase in protection which is afforded by those contraceptive devices or measures, excuse me. So there's also language in the law to talk about sexual abuse, reporting sexual abuse, and legal options available for victims. So we think this is all good things that are in the law. There's also some bad things, we believe. So the law states that abstinence from sexual activity outside of lawful marriage is the expected social standard. So this language can be shaming for those who have had sex, even those who have been raped or sexually assaulted. So it's not only shaming, but it's also not factual, because how can we sort of prove what is the expected social standard? Who decides that? Who's to say that a social standard is prevalent for our current time? This law was written many years ago. While that might have been the social standard back then, it may not be anymore. And so we think that this language is not great. And then what we consider to be the ugly, and many of you may know where I'm going with this, is that this is verbatim what our law says in regards to LGBTQ people. So I'll let you read it. So this is obviously the most damaging part of the law because it's quite homophobic. It is not only harmful to LGBTQ people, but it's false. They're trying to speak to a social standard that cannot be proven, and they're referencing an anti-sodomy law that was struck down by the Supreme Court in 2003. So it's literally factually inaccurate. So a lot of national organizations that do work to remove this kind of language in state laws refer to this as a, quote, no promo homo law, which means that we can't promote homosexuality is the intent behind that sort of language. We're only one of 5 states that has this sort of language in our law. The other 4 states are Mississippi, Louisiana, Oklahoma, and Texas. So all southern states, interestingly. So now, if you have any questions about the sex ed law, you just drop those in the chat box and I will do my best to answer them. I'll give you guys a minute to see if you have any questions. Why has it not been updated? Great question, Carol. We'll talk in a few minutes about what's being done to improve the law, or what we haven't been able to do yet to improve the law. But the biggest reason I can answer is that there's no sort of, nothing really forcing the legislature to change it quite yet. We have lots of organizations that are working to update the law, but just haven't been able to get it over the finish line yet because it's just not a priority for our legislators. Is this enforceable, or how is it enforced? So it's not, that's a great question. It's really not enforceable. Because it's not a mandate, nobody has to teach sex ed. If they teach it, then they're supposed to follow these guidelines, but there's nobody checking up behind people to find out if they're following these guidelines. So great question. Unfortunately, not enforced at all. Valerie, so we're having to meet with our powers that be because it appears that we are working outside the law. What is your thought? I don't believe that there is curriculum available that will address the homosexuality piece. So actually, there's lots of curriculums, even evidence-based curriculums that, I mean, include, are very inclusive of LGBTQ students. And so I understand, I think I'm beginning to understand your question, Valerie, that if we are teaching with those curriculums that are more LGBTQ inclusive, we're actually not following the law. Got it. Yeah, it looks like you've just confirmed that. So yeah, I guess that is true. And you know, you have to weigh those sorts of things when you're teaching sex ed, what's gonna do the least amount of harm. I would, if I were teaching sex ed in the classroom, I would never include any sort of language that would be homophobic or that would put down LGBTQ people. I would try to always be inclusive and affirming. That is trauma-informed. That is what every national organization, doctors' organizations, psychiatry, social work organizations all promote. So the fact that our law hasn't caught up yet is unfortunate, but you wouldn't catch me in the classroom saying anything in terms of the homosexuality piece that is written in the law. So great questions. Great questions all around. So let's move on to some other pieces that influence sex education in Alabama. So there's the HIV/AIDS education resolution. Even though we don't have mandated sex ed, we do have mandated HIV/AIDS education. It requires that schools teach about AIDS and HIV as part of their health education curriculum beginning in 5th grade. However, this resolution does not have any funding attached to it. So it's a requirement, but it's an unfunded requirement, an unfunded mandate, if you will. Teachers are not provided any professional development specific to HIV/AIDS unless they seek it out themselves. And there's no tracking mechanism, so we know what each school is teaching. So someone asked earlier, how is this enforced? This is another one that is hard to enforce because there's no money behind it and nobody's really checking. So some schools will bring in a guest speaker for an assembly, like a one-day assembly. Often that person is HIV positive. That may come with its own issues. Using that person to speak, you know, for all people with HIV can be really problematic. Some schools do have units in their health curriculum, so it totally is variable, and it's up to each local school and school district what they do to meet this mandate. I think impressively, this is sarcasm, that many schools are quite crafty in managing to talk about HIV without talking about sex. So because there is no mandate for them to talk about sex, but they do have to talk about HIV, they can talk about all the ways you can get HIV. They may say you can get it by having sex with no real details about that. But they don't have to provide information on how to use a condom to prevent HIV. You know, they might talk about not using needles, or that a mother can pass it from herself to her baby through breastfeeding, but they're just not talking about how do I prevent HIV in a sexual situation. And so I just think that's sort of a funny anecdote that we're talking about HIV, we're mandated to talk about HIV, but we don't have to talk about sex. So then the other piece of policy that is influencing sex education in Alabama is the Alabama Health Course of Study. So in 2019, the Alabama State Department of Education released their newest health course of study. The document is meant to be updated every 2 years. This time it went 3 years, so the latest one before this was 2016. So the goal of health education in Alabama, as stated in the health course of study, is to help students develop optimal health for life. And I point this out because the health course of study mirrors the law with a strong emphasis on abstinence. But if the goal is optimal health for life, and we know that many people, most people, will have sex at some point in their life, then we should be presenting a more comprehensive approach to sexual health so that young people will know how to take care of their sexual health at any point in their life. So I sometimes will say, it doesn't matter if you have sex on your prom night or your wedding night, you need to know how to protect your sexual health. And so I just think it's funny that the same policy that says they want to promote optimal health for someone's whole life is only really relying on abstinence. That's just not a reality for most of us. The health course of study also promotes health literacy and is meant to build a foundation in which young people are able to use health information and services in ways that enhance their health. The health course of study outlines the minimum required content that students in grades K through 12 are expected to learn in a health course of study. Once again, if abstinence is the minimum, then the sky is the limit. But what we found is that many teachers do not feel comfortable or competent in the subject material to go above the minimum. We found that teachers want more guidance on what should be included in a sexual health education program, and that they're often afraid they may overstep or break the law. We also know from CDC School Health Profiles, which is done every year, that more than half of lead health teachers in Alabama have not received sufficient professional development to teach sexual health topics. So we just don't have educators who feel confident to teach this information because they're not given the tools to do so. You know, teachers, especially right now, I think are just awesome human beings and heroes, and they're doing so much for our young people, but they're not being given the tools to really help our young people thrive. The health course of study does not dictate curriculum or teaching methods. So I think I actually advanced one too many, but I just want to point out that in 2019, there was a committee that was assembled to select a health curriculum as an option for schools. So it's just an option, not a requirement. The Alabama campaign had a chance to review that curriculum. So on the plus side, it was curriculum, I'm sorry, for middle and high schoolers. That's the two that we reviewed. So on the plus side, both curriculums contain medically accurate language. They talked about condoms, and they provided information on healthy relationships. The high school curriculum, but not the middle school curriculum, talked even about sexual violence, sexual assault, and those sorts of things. But unfortunately, it also failed to mention how to prevent pregnancy, and in fact did not even explain how pregnancy occurred. It even went as far as providing information for young people about how detrimental pregnancy would be for them. But again, it never told them how a pregnancy happens or how to protect themselves from pregnancy. We were able to submit some comments and even recommend some curriculum that might be a better fit. Unfortunately, I don't think anything ever happened with that. And they did pass that curriculum through. So that is a curriculum that many schools may be using, or at least it's an option for them to use. So again, the health course of study states that the content standards are minimum, but they're not exhaustive. So this means as long as the minimum is covered, that you emphasize abstinence, you can go above and beyond. But the problem remains that teachers don't know what that looks like, or they lack the knowledge and skills to provide that information. So I just want to take a break here again to let y'all ask any questions that you might have about the HIV/AIDS mandate or the health course of study before we move on. Valerie asks, what was the curriculum, if I don't mind sharing? I don't mind sharing, but I don't have the name in front of me. So I'm just going to make a note to share that with y'all in my follow-up email. Okay, it looks like maybe we don't have any other questions, which is great. I hope that means that I was able to answer any questions that you had. So, oh, let me just admit this person. I know one school in another area of the state is using Choosing the Best Life VHS version. VHS, that's kind of funny. Yeah, if Choosing the Best Life is similar to Choosing the Best, then that's definitely not the best curriculum, but that's a different conversation. Matt, did the 2019 optional health curriculum include updated information about HIV, STI prevention and treatment? For example, pre-exposure prophylaxis, otherwise known as PrEP, and the fact that people living with undetectable HIV cannot sexually transmit the virus. Great question, Matt. I actually remember taking pictures of the curriculum because I had to go to a library that was out of, I live in Montgomery, so it was out of city for me. I had to go down to Troy because only select libraries throughout the state had the curriculum for review. So I had to take pictures of the curriculum, and I would have to go back and look at those pictures and see if it included updated information. I do recall that they were using STI instead of STD, so they had at least made that update, but I'm not sure if they were discussing PrEP or undetectable virus load. So I'll check into that for you and see. Let's make one more note. Okay, so I'm going to move on. So another new piece in the 2019 health course of study that was not included in any other previous health course of study is this piece. So they said under this title, Sex Education Local Policy, it is highly recommended that local school systems develop and adopt a policy regarding the instruction of sex education content for their schools in accordance with laws, regulations, and resolutions in age and content appropriate contexts. So on first read, it appears that this may be another way for local schools to get around any sort of sex education. They can just make a policy that says we don't talk about it, or we only talk about abstinence, or abstinence until marriage. However, at the campaign, we really saw this as an opportunity for advocacy, to develop some model policy, and a way to get quality sex education in public schools. Of course, with local control like this, you can get sex education that looks like this, or you can get sex education that looks like this. And if anyone is wondering, this is Mean Girls. This is like the iconic, everybody who works in sex ed has seen this this GIF or image. And then this is Parks and Rec, where the main person, Leslie, goes to teach sex ed to senior citizens, and she's met with some pushback. But mostly what you're going to get in these situations is this. And this is from Netflix's show Sex Education. And it's a British show, and it's all these young people who have no access to sex education, and they have a ton of questions, and they're all having sex. And the middle boy's mother is a sex therapist in town, and so eventually she comes and she helps them, you know, do some sex education. But they just have all these questions and all these curiosities, and nobody's answering. The adults in their life aren't answering their questions. And so mostly in Alabama, that's what sex ed looks like, is just these young people who have so much knowledge that they're lacking and nowhere to turn. No trusted adults, and well, they have trusted adults in their lives, but they're not talking about sex. So that's really the problem with a lot of these policies, because there's no mandate to teach sex ed and no set curriculum or standards outside of the health course of study, which gives the absolute minimum. So we don't know what, if anything, is being taught in public schools. We know anecdotally from young people, you know, they tell us the things that they're learning. Oftentimes it's not good and not medically accurate, and in many cases very harmful. So that's sort of the policy situation in Alabama. So now I just want to turn our attention to how these policies are influencing or affecting sexual health behaviors and outcomes. And we're going to do that with a poll. Well, we're going to do a combination. We're going to start with a poll. So if you are on your computer, if you will, you know, go down to your bottom, hover, you should see a toolbar pop up. And if you click on poll, I'm about to launch it. So it's launched. There's just 5 questions. If you'll go through and answer, I'll give you all a couple minutes to answer those. They're true, false. Happy polling. I'm going to stop sharing my screen for just a moment. Looks like we still have some folks who haven't done it, so I'm just going to leave it up for another minute or so. Oh, now they're pouring in. All right, last few seconds. I'm going to turn it off so we can review the answers. All right, and end. And I'm going to share the results. You should be able to see the results. Okay, so according to the most recent data available, Teen pregnancy is on the rise in Alabama. So actually, that is false. And it looks like, well, I probably shouldn't have downsized that because now I can't see my poll. Sorry, y'all. Well, here we go. So it looks like a little more than half of you thought that was false, and the rest thought it was true, so almost half and half. So that's false. Teen pregnancy in Alabama is actually at a 10-year low, and teen birth is also at a 10-year low. The teen pregnancy rate is 19.2. That is according to preliminary data for 2017 from the Alabama Department of Public Health. So then let's see. Mobile, Alabama has the 5th highest sexually transmitted infection rate in the United States. True. 77% said true, 23% said false. That is actually false. Montgomery, Alabama has the 5th highest STI rate in the United States, and Birmingham, Alabama has the 20th highest rate. So we are so lucky, so honored to have 2 of our most populous cities in the highest STI rates in the country. So very unfortunate fact, but it is not Mobile. 3, the percentage of Alabama high school students who used a condom during last sexual intercourse has declined for the past 10 years. So about half and half, true, false. So that is actually true, unfortunately. According to the 2015 Youth Risk Behavior Survey, which is the most recent data we have available, in 2005, the percentage was 61.8% of sexually active Alabama high schoolers said that they used a condom at last sexual intercourse. But in 2015, only 50.9% said that they had used a condom at last sexual intercourse. So it declined by about 10%. Adolescent females who identify as lesbian or bisexual are more likely to have ever been pregnant than their heterosexual peers. So we got about half and half again. That is actually true. So according to a study published in Pediatrics Journal in 2018, and so that's Pediatrics is a medical journal, peer-reviewed, adolescent females who identified as mostly heterosexual with same-sex partners or lesbian were twice as likely to become pregnant, and adolescent females who identified as bisexual were 5 times more likely to become pregnant than their heterosexual peers. And so the research in that study points to a greater amount of childhood maltreatment, such as being kicked out of their homes, or generally just bad childhood environments, bullying, and gender nonconformity. But I think we also know that LGBTQ students are often left out of sex education curriculum. We can certainly point to our own law that has homophobic language. And so they're just not adequately equipped to understand their risk for pregnancy or for causing a pregnancy. And then the last question, adolescents ages 13 to 19 account for the highest rate of new infections in new HIV infections in Alabama, and we had about half and half. That is actually false. Ages 13 to 19 account for the highest rates. In the 2017 HIV surveillance annual report from ADPH, which is their most recent available, young adults ages 20 to 29 is the age group with the highest rate of new infections, and they actually have 44.4% of all new infections, which is just a huge burden for that age group, considering that they do not make up that much of the population. So thank you for participating in the poll. I think it's interesting just to see where folks think the data is, and so we're just going to review some more of that data. Let me get my screen sharing back on here. Oops. Thanks everyone for your patience as I do all this. All right, so The teen pregnancy rates in Alabama, as I mentioned in that poll, is actually declining. We're at a 10-year low. And nationally, we're seeing decline as well. So Alabama still has higher rates compared to other states of the United States, but we have seen a decline in the last 10 years. And of course, we've also had a decline in our teen birth rates as well. What's not declining, unfortunately, is our STI and HIV rates. So young people ages 15 to 19 account for only 6.5% of the total population in Alabama, but they make up 31.2% of all chlamydia cases in 2019. They made up 21% of all gonorrhea cases in 2019, and they made up 5.8% of all syphilis cases in 2019. So as you can see, they bear a disproportionately high rate of chlamydia and gonorrhea cases in Alabama. And as we know from our poll, Alabama has 2 cities in the highest of top 20 cities in the United States with high STI rates, with the highest rates of STIs, I should say. And then in terms of new HIV infections, as I said in the poll, it's actually not this age range, the 13 to 19 age range, that's the highest. They only bear 5.5% of the burden. Still, you know, we would love to see that closer to 0, but it is much smaller than the 44.4% that 20 to 29-year-olds make up. And so we can speculate that these young adults, 20 to 29, you know, they're not that far removed from public education, and that they probably didn't receive adequate sexual health education to help them prevent HIV. And there's lots of other barriers that may have led to that, but that is certainly a consideration. So then if we switch our view to behaviors, so there's outcomes, there's, you know, the health outcomes that we know of, and then there's the behaviors that we know a little bit of. The Youth Risk Behavior Survey is a tool that is done every 2 years. It's an effort between the CDC and state departments of education. So the Alabama State Department of Education and CDC work together to get survey data from Alabama high school youth. Unfortunately, in 2017, we did not have enough data collected to have weighted data, and the only way that they can compare state to state is to have the data weighted, and if it's not weighted, then they just don't release it. So the most recent we have is 2015. We're really hopeful that we'll get 2019 data this year. So in 2015, we saw a decline in a lot of sexual risk behaviors. Less students reported ever having had sex, which is interesting because most people believe that young people are having sex more now than ever, but that's actually on a decline. The percent of students who had sex before the age of 13 has declined. The percent of students who have had sexual intercourse with 4 or more people in their life has declined. The percent of students who are sexually active in the last 3 months has declined. However, unfortunately, also, the percent of students who used a condom at last sexual intercourse has declined. And I didn't include this, but I can send it later, that the percent of those who used any birth control method has also declined. That's a data piece that they just started collecting, and so I just didn't include it in this. But so the protective factors are declining just as much as the sex itself, which is unfortunate. And we also know, unfortunately, that sexual health behaviors among LGBTQ students, they have higher incidence of sexual risk-taking behaviors than their heterosexual peers. So what I'm about to show is United States data, not Alabama specific, and this is from 2015. So US high schoolers who have ever had sex, 50.8% of LGBTQ students versus 40.9% of heterosexual students. 7.3% of LGBTQ students have had sex before the age of 13 versus only 3.4% of heterosexual. 52.5% of LGBTQ students did not use a condom at last sex, versus 42.2% of heterosexual students. And 26.4% of LGBTQ students did not use any method to prevent pregnancy, versus 12.4% of heterosexual students. And so again, I would point to a lack of inclusive sexual health education as to why these sexual health behaviors are higher among LGBTQ students. So, are there any questions? I'm going to take a break here to see if there's any questions about this data. I need to pull up my chat box. Oh dear, where is it? Oh, there it is. Any questions about the data? Will I share the slides after the presentation? I'm happy to do so. Any other questions about the data? Okay, I'm going to move on. So, improving sex ed in Alabama. So let's talk about some things that are being done to improve sex ed in Alabama. For at least the last 7 years, the Alabama campaign and other organizations and individuals throughout the state have advocated for the removal of the homophobic language in the sex education law. And in the last couple of years, there's even been a push to remove outdated language. So the law refers to STDs instead of STIs, and STIs is more medically accurate. It also refers to AIDS education, and it should be HIV education because that's medically accurate. So last year that effort made it through the Senate, but not the House. And this year, of course, the pandemic has precluded any further efforts for this year's bill. So as a colleague of mine said, maybe next year, third time's a charm. We will see. But I do want to point out that even though our legislators don't seem to have any urgency to change this law, we do have significant support for sex education in Alabama. So in 2017, the University of South Alabama, the Alabama campaign worked with the University of South Alabama to survey parents of school-age children. And of those parents that were surveyed, 82.7% said they believe that children should be taught sex education in school. And when they were asked about topics, 97.5% said they believe it is somewhat or very important that their children learn to talk to a partner about birth control and STIs. And 98.1% believe it is somewhat or very important that their children learn about the use of condoms. So we're talking close to 100% of parents, when you get down to the topics, think that young people should be learning about birth control and condoms and STIs and how to deal with those things with partners, which is just was really shocking to me, because oftentimes we wanted to make that very specific to Alabama, because oftentimes we will hear from legislators, well, that's in California, that's in New York, that's in, even this survey was done originally just in Mobile County, and it had similar results. And legislators would say, well, that's in Mobile, that's not Alabama. Well, it is Alabama, actually. And someone just asked what year the survey was. It was in 2017. Also in 2017, the Alabama campaign surveyed community stakeholders who had very similar opinions. So these stakeholders were from Alabama's Children Policy Councils, which are in every county in the state, and 82.5% said that sexual health education should include more than abstinence because they believe that young people are engaging in sexual risk-taking behaviors and need more comprehensive information. And they are correct. We know from the data, from the YRBS data, that young people are engaging in sexual behaviors, and so they need information to reflect the behaviors that they're engaging in. So what can we do? How can we improve sex ed in Alabama? That's something that I would love for us just to take a moment to sort of brainstorm. For the Alabama campaign's perspective, we need more strong advocates. As you can see from these two data pieces, there is super strong support for sex education in Alabama. But it's the vocal minority who is winning out and making it so that sex ed can't be improved in the state. So what other things can we do to improve sex ed besides becoming an advocate? Or maybe more specifically, what ways can we be an advocate? And you can just write your answers in the chat box. Jessica says, research, expand our research of parents' perspectives. Yes, research is definitely, can be really helpful. As, you know, and if we're talking to legislators, I think personal stories are also really important. So like have your research, have your data, but also have your personal stories. Expand our research of parents' perspectives in other counties. So the parents survey is representative of the whole state. It's not a specific county. This same survey was conducted many years ago in Mobile County, but the data that I'm presenting today is all over Alabama. But it may be helpful to have specific county data available, parent survey data available, because it probably does change county to county. Carol asks, what have you seen about sex ed in churches or church groups? Good question, Carol. It's really, it's kind of all over the place. Some churches are more progressive and definitely want to provide information for their young people. I worked with a church a few years ago in Auburn that was providing an evidence-informed program called Our Whole Lives, which is a more comprehensive program, and it's also a more progressive program, and so it's definitely not something that maybe all churches would want to adopt. We also have heard anecdotally that a lot of African American churches are more open to doing a sex education program in their church or with their church youth than other churches are. But we don't do a lot of work, or haven't done a lot of work historically with churches. But that's what I know. So another entry point might be when we talked about the health course of study, the local policies in sex ed. If you're in a community and you don't know what your sex education policy is, one great way to become an advocate is to find out what that sex education policy is. Maybe there isn't one, but then you can start asking the questions, okay, so are we teaching sex ed? Who's teaching sex ed? What are their credentials? Can I review the curriculum? You know, and those are all great things to do on the local level in terms of advocacy. And, you know, you don't have to go into Montgomery and talk to your legislator. I would also say to connect with us if you're interested in becoming an advocate for this issue. We're really happy to help y'all advocate for these things in your local communities. We're a pretty small organization, so for us to go out into each community and try to do this advocacy by ourselves is impossible. We really do need folks on the ground who are familiar and who are strong advocates. So if that's something that you're interested in doing, I would just encourage you to reach out to us. We do training. We can help you craft some policy for your school board, we can make those connections and have conversations with school officials to help them choose a curriculum that might be more comprehensive. So reach out to us for sure. So I have somehow taken up a whole hour and we haven't even got to our skills building piece. I totally understand if people need to step away. This is my first time doing it, so I'm sorry that I'm running over, but if you would like to stay, I would love for you to stay and I'll continue and do the inclusive sex education piece. If you can't stay, this is already being recorded, so I will share it with you and you can go back and watch it later. But I'm going to keep going, and if you need to leave, I totally understand. So let's talk about some ways to build inclusive sex ed. Thanks, April. I totally understand you have to go. Thanks for being here. So let's talk about ways that you can build some inclusive sex ed into the work that you're doing with young people. The first thing we're going to do is a values assessment. So if you do have a piece of blank paper, this isn't something you're going to share, so it can just be a piece of scrap paper, but I'm going to present you with some value statements by Andy. I'm going to present you with some value statements, and I want you to say whether you agree or disagree, and just your gut instinct. It doesn't have, I don't want you to think about it too long. We're going to go through it pretty fast. But if you guys can just answer agree or disagree, and you won't be sharing these answers. So here we go. First question, or first statement, value statement. Some young people will always have unprotected sex. There's nothing we can do about it. Do you agree or disagree? Young people can be taught to consistently and correctly use condoms to protect themselves. Agree or disagree? Carol, can you don't need to share your answers. If you could just write them on a piece of paper, that way you can, because it's more of a thinking exercise than a sharing exercise. 3, young people should not have intimate relationships until they graduate high school. Four, all people should wait to have sex until they are married. If someone has HIV, they should not have sex. Parents should be the only people to teach their children about sex. Condoms should be made available to young people at the school nurse's office. Young people should be allowed to express their gender in whatever way is most comfortable for them. Young people should have access to contraceptives that make the most sense for their lifestyle. And finally, young people should not be parents. And if they are, they and their child will have a hard life. Okay, so again, you're not sharing anything, but I want to introduce us to a concept called value neutral or value neutrality. So I want you to consider the answers that you wrote down. There aren't necessarily any wrong answers, but did you find yourself falling hard on one side or the other, agreeing or disagreeing? So you may have agreed or disagreed, and that may come across to some people as shameful or stigmatizing. You may have agreed or disagreed with a statement, and that may come across as glorifying. But what if there's a third way? I think that when we're working with young people, the goal should be value neutrality. So for instance, there was a statement in there, young people should not have intimate relationships until they graduate high school. So for some young people, that's the right choice for them. For others, it's not. Your opinion can be what it is, but when we're working in sex ed, we want to move towards neutral. Value neutrality allows us to be inclusive of all young people. And I do just want to point out that and give credit to the Michigan Organization on Adolescent Sexual Health. I got some of the following slides and their concepts from one of their presentations I attended last year. So what are some concrete strategies for neutrality and inclusivity? I'm going to give you some. So the first is to avoid making assumptions. It's of course human nature for us to make assumptions based on what we see of other people. However, we do not have to act on those assumptions. Just because someone looks or dresses a certain way does not give us permission to make assumptions about who they are or what they believe. So avoid making assumptions when you're working with young people. Use inclusive language. So here's some examples. And if you have others, I'd encourage you to put them in the chat box, but these are the ones that I've come up with. So instead of saying teen moms, maybe change your language to young parents or young moms and dads, because there are certainly young dads. Instead of using language like husband and wife, boyfriend and girlfriend, move your language maybe to partner. Or spouse would be another one in that situation. Instead of only ever referring to marriage, you might want to start referring to relationships. Instead of saying unwanted or unplanned pregnancy, we might talk about unintended pregnancies. So these are just a couple of examples. Does anyone have another one? And if you do, you just type it in the box and I can read it. So we also want to avoid shaming language and re-traumatization. And so there are some curriculum, even those that are evidence-based, which can be shaming and traumatizing for young people. So for example, there is a curriculum where they're asked, the facilitator is asked to brainstorm with the young people, what are some consequences of sex? And the curriculum is sure to point out that a bad reputation is a consequence of sex, and that they should make sure that's included on the board. And that can be really shaming for a young person who has had sex, who has been forced to have sex. It can be certainly re-traumatizing for that latter group. And so that's not a trauma-informed or non-shaming way to approach sex ed. We want to avoid this sort of shameful way of depicting teen parents or those who have sex before they leave high school. And I showed this as an example. I think it's a really stark example of what we want to avoid. So we also want to include visibility and examples of our families and relationships. So if you only have examples of relationships and families that are heteronormative, which means that they are only a man and a woman and a straight couple, or cisgender, which means it's only a man and a woman, and those, or it could be two women and two men, but they're not trans, and so they identify with the gender that they were born with. With the sex that they were born with, that you're sending a message to young LGBTQ people that their relationships don't matter and that they aren't part of this discussion. Another problem with that is that there's a danger of falling into stereotypes. So for instance, not all young fathers are uninvolved, not only young men pressure others into sexual behaviors, unplanned pregnancy happens to white people as well as Black and brown people. So make sure you're checking your examples to make sure that they're diverse and representative of all young people, and certainly representative of the young people in your program. You want to focus more on possibilities when you're talking about the data than certainties. So for example, instead of saying, if you become a teen parent, you won't finish school, you could say it might be more difficult to finish school. And so a lot of these things that are in this graphic are also certainties, that you're certainly giving up going out with your friends, and you're certainly giving up a college diploma. And that's just not true. We also want to create respectful spaces with young people. So a lot of the curriculum that we work with recommends making group agreements. And so you create these agreements with the young people in your class, and they're part of that creation process, and so they have buy-in. And then the trick is to use the agreements to the advantage of yourself and to those that are in your class. So if you have an agreement to be respectful of diverse opinions, and then someone in your class violates that agreement, they should be reminded of the group agreement to be respectful of diverse opinions. Anytime bullying or making fun comes up, you should shut that down. And in that way, you make it very clear to the young people in your class that this is a safe space for them to be and express themselves and express their opinions, and to talk about such a sensitive topic as sex. So I want us to practice some value neutrality and inclusivity. So we're going to read the following statements. I want you to think about how they could be rewritten to be value neutral and inclusive. Think about what is the goal of the message. What words or phrases might be shaming or stigmatizing? How could you adjust the wording or phrasing to be more inclusive? And so I'm going to give you a few minutes to read it, maybe jot down a few notes, and then I'm gonna make it so that you can unmute yourself. And if you have something you want to say, just unmute yourself and give us your rewrite. And then I'll turn that feature off and we'll move on to the next one. Okay, so here's the first example. And I should point out that these are examples from real curriculum. So this is stuff that young people are likely hearing already. So the reality of teen parenthood may not always be as positive as imagined. Actually, babies born to teen parents are at much higher risk for health, financial, and social problems. Teen parents are much more likely to live in poverty and never reach their academic or career goals. So jot down a few notes. Try to think about what's the goal of this message, what might be shaming or stigmatizing, and how could you reword it? And then I'll unmute y'all.
Babies that are born to teen parents are maybe.
So I have you unmuted. So if you, some of you have your mics on already. So if you're speaking, you might want to stop unless you want everybody to hear you. But if you would like to speak, now is your time to do so. And tell us your name when you start speaking. Is there anyone who wants to take a shot at rewording this example? Don't be shy, we're all learning. Okay, I'm gonna going once, going twice.
I can try.
Okay.
This is Isabel. Young people deserve the same access to resources that all other parents have. And they particularly might need specific support because of different barriers to access that they have as young people who are pregnant and choose to have children.
Okay. That's great. So you're saying that you're staying away from the shaming language, and you're getting to the goal of there might be additional supports that young parents would need. I like that. Anyone else? Okay. Thank you, Isabel. I'm going to mute you all again. Okay. And I'm going to give you just what I came up with as a potential rewrite. I'm sorry, I didn't come up with it. The people that did this presentation originally did. So they said, young parents may face additional challenges financially, academically, but with the proper support, these challenges may be overcome. And so similar to what Isabel said, you know, focusing on with the proper support that they can overcome these challenges and be successful. Okay, so here's our second example. It's important to be aware of the negative consequences of sexual activity, including STI transmission, sexual violence, and pregnancy. So how might you rewrite that? And I'll give you a couple minutes and then I'll unmute you again and you can speak if you wish. Try to remember to think about what is the goal of this message? What might be shaming or stigmatizing? And how can we be more inclusive? Okay, so I'm going to unmute. If you have an idea, just go ahead and tell us your name and what you think. So Valerie said to me in a chat, what about removing the word negative from the statement? So I think that could be one way of doing it. I think consequences still connotates a negative. You don't really think about positive consequences very often. So maybe removing negative consequences and just saying it's important to be aware maybe of the responsibilities or things that come with sexual activity. But yeah, you could maybe remove negative and consequences and get to a similar goal. Does anybody have one?
I was thinking you could say that sexual activity is a personal choice, but good consideration of STIs, transmission, sexual violence, and pregnancy should be carefully considered.
And I'm sorry, who was speaking just now? Thank you, Carol. Yeah, absolutely. So it's, you know, sexual activity should be a personal choice, but there are some things to consider before engaging in sexual activity. And here are some of those things you might want to think about. Did anybody else have one they wanted to share?
Hey, this is Matt Pagnati with AIDS Alabama. I think it could be important too to have an aspect of it as far as making sure youth and young people have the tools, the knowledge to make that decision in regards to those factors. I'm not sure how to best word that, but not just considering all of those results, but also making sure that people are empowered to take whatever steps prevention-wise that they feel would be best for them.
Absolutely. So not just saying, you know, you could get pregnant or you could get an STI, but like, here are the things that you can do to protect yourself if you're going to engage in sexual activities. So I'm going to mute you all again and give you what MOASH came up with. So they said, it's important to be informed about the possible results of sexual activity, one being unintended pregnancy. It's also important to have knowledge about STI transmission and healthy relationships. So that's just one potential rewrite. I liked all the ones that y'all came up with as well. So this is our final example. So if you remain abstinent, you will have self-respect and a good reputation. Think about that. Think about the goal behind that message. What might be shaming or stigmatizing? And think about how you could reword that. All right. I'm going to unmute, and if you would like to say, go ahead and tell us. And tell us your name first. Did someone want to speak? I was hearing something from a phone. Last call. See if anyone has a potential rewrite. Okay, I'm going to mute you all again, and we're just going to, I'll move on to what we came up with. Okay, so what we came up with was, everyone should decide for themselves whether they are ready to have sex. Then, regardless of what you do, you can have self-respect because you followed your own convictions. So it gets to the idea, I think the idea, well, the idea previously was clearly from a curriculum that was very bent on abstinence only. But as we talked about, a more comprehensive approach is needed for most young people. And so this gets us to a more comprehensive approach. So we're not saying everyone go out and have sex, or if you go out and have sex, it's no big deal. We're not glorifying, but we're also not shaming. We're going to this neutral place. And so we're saying everyone should decide for themselves whether they're ready to have sex, which is true. Everyone should have that choice for themselves. And then regardless of what you do, you can have self-respect. So Isabel points out that this rewrite seems a little rough because it seems a little shamey for folks who were sexually assaulted. That's a fair point. And because as you point out, not everyone can decide for themselves whether they're ready to have sex. And so does someone have maybe another idea for how we could we remove something? I think what we want to stay away from is having sex or not having sex brings you shame or brings you respect, or, you know, we want to make it so that there's sort of informed decision making happening. but it can be hard to write it in an inclusive way for, you know, being mindful of potential trauma of the young people that we have in our classes. Absolutely, people should not be judged for their sexual behavior and past practices, of course. So I mean, I think it's a fair criticism that this is maybe a little rough still, but it's we want to be moving away from the absolutely shaming language or the absolutely glorifying language into a more neutral space. So I would just ask us to maybe think about that. And if you come up with a great answer, you know, after we get off here today, then maybe you can email that to me, and I'll also think about it and think about how we can make it better for future presentations. Okay, so with that, because I've already kept you past an hour, I just want to ask, what questions do y'all have, if any? And I will do my best to answer them here. And then we will be finished. Questions about anything that we've covered today, the skills building, the data, the policies, advocacy. I really appreciate everyone taking the time to be here today. This is a great turnout for our first webinar, and I think it went much smoother than I could have imagined. Between having a chat box and, you know, switching between things. So I really, really appreciate y'all being here. Jada is asking, would love to connect with others in Mobile. Would you guys mind sharing your email if you're in Mobile? I can also share that information if the folks from Mobile are comfortable with that. Or it looks like some folks are sharing. So just as a wrap up, please fill out the electronic evaluation that I'm going to send right after this is finished. I definitely want your feedback, how we can make this better. You know, we may be in this pandemic for the long haul, and so this may be a format that we are using more often, and would love to know how we can just make it better for y'all. Thank you so much for being here, and I hope to talk to y'all soon.